And we are back at one more fabulous episode that's going to come today for everyone who's interested in brain health, right, Doctor?
All my episodes, I'm so excited about this one. I love GLP-1, I love testosterone, but brain function, brain health, brain fitness, that's all we're going to be talking about. And in the context of this new device that I have at my office and that I've done a deep dive, Transcranial Magnetic Stimulation, TMS. So I'm all excited.
And if the viewers or the listeners missed our previous episode, I mentioned I saw Dr. Rudy treating his wife, his patients, and also Serena Williams. So
So the
good.
great Serena Williams received treatment with TMS. She placed it on her social media. If anybody's interested, it's on my social media, on her social media. And she talked about brain health and how she always, works out for her body, but never took care of her brain. And it's all of us. What do we do for our brain? Right? Yes, we read, we try to do word puzzle games, we try to learn new language to make sure we stimulate our brains. But we're going to do a deep dive into the brain being the command center of the body, the most important organ responsible for vitality and our interaction with the outside world. And we never pay attention to it. We don't have specific protocols for it. We have protocols for our muscle. We have protocols for everything else in our body. What about our brain?
True. So, Dr. Rudy, before we go into understanding what is TMS and all the deeper questions, but before that, can you share what first drew your attention to TMS therapy and what or why it stood out for you that you were like, oh yeah, I want to investigate and pursue this in your practice?
So, I see myself as an anti-aging, age management doctor. That's what we call it, because we can't stop aging, but we manage as we age. And, I've always said in all the podcasts we've done, my two main things I go after, I want to decrease body fat, especially decrease that visceral adipose tissue and increase lean muscle mass, because those have been found to help with a lot of the symptoms of aging, the symptoms of chronic disease that we see as we age, inflammation. But what about the loss of brain cells that happens as we age? What about the decrease in cognitive function that happens as we age? That happens as we are more toxic. The more body fat we have, the less muscle mass we have, the less our brain function is. And for me, the age management physician, the optimization, the biohacking physician, I always say, yes, I want to take care of my physical body, but what about my brain, my mind, my cognitive disposition? Because who wants to live till you're 100 if you don't have good brain function? So when I think about the evolution of my practice, I started first with nutrition, the lowest hanging fruit of wellness. How do you leverage nutrition to live a better life, to live your best life? Decreasing, processed foods, eating whole foods, more protein intake, more good fats. That's why the Mediterranean diet is such a good diet, both for cardiovascular and brain benefits. Then I went into hormone replacement to really modulate and improve our lean muscle mass, because we know that muscle stimulation and the more lean muscle you have, the better your aging, the better your brain remains. Then adding all those, I started seeing, but what about the brain? And, I've been a speaker for this company, BTL, now for a long time. We have some of their machines that help decrease body fat and increase lean muscle mass. And they came up with this new device called the ExoMind, which is the most recent advancement in TMS, Transcranial Magnetic Stimulation technology. And then I did a deep dive on what TMS does. And then I became completely enamored with this technology. So let me start from the beginning. So transcranial magnetic stimulation, TMS, it's the application of electric currents that generate a magnetic field that can stimulate your brain into forming new brain connection, what is called neuroplasticity. The brain is a wonderful organ that the way it works, it's almost like a computer. The more connections there is, the more that the basic nerve cells called the neuron, the more they communicate with each other, just like a computer, the better output the computer can give you. So as we age, during growth, adolescence, our brain cells grow. But like everything in life, including hormones and brain cells, starting at about the age of 30, 35, we start losing brain cells. We start losing brain connections. It accelerates a lot in the mid 50s and accelerates even more in the 70s. That's why what we call senior moments, quote unquote, when people start showing memory lapses, cognitive decline, they're not as sharp as they used to be. It's happening to me. Studies show actually that there's a big steep decline in 50, 55 years old. I'm 55 now. I try to keep as much as I can with my hormone replacement, keeping my body fat low, making sure I read a lot. I do brain word puzzles to keep my mind stimulated. But how do you prevent the loss of nerve cells as we grow? Actually, I came up with a new term, and I call this neutropenia, the decrease in nerve cells. As we age, we have what is called sarcopenia, the loss of muscle cells, osteopenia, the loss of bone cells, the decrease in bone density. Well, what about neuropenia? Neuropenia is the decrease in brain cells that happens as we age. And there's a direct clinical correlation is that the lower your connections in the brain, the lower your mass, your brain mass, the more cognitive dysfunction you may have. So if we're going to take care of our physical body, what about taking care of our brain fitness? And what are things that we can do to increase neuroplasticity? Let me first describe what neuroplasticity is. Neuroplasticity is the ability of the brain to reorganize itself based on stimulation. That's why when you learn a new language, you learn to play a new musical instrument, the brain forms new connections. They always tell you that try to do things with your non-dominant hands. Establish new neural connections. The more neural connections, the better your brain functions. That's neuroplasticity. So how do we stimulate neuroplasticity? Things that we can do easily, everyday things. One of the most important things, resistance training. Because the more lean muscle mass you have, the more it increases something called BDNF, brain-derived neurotrophic factor, which is almost fertilizer for the brain cells to enhance neuroplasticity. Um, Reading, mathematics, brain puzzles, um, breath work, meditation, mindfulness, all of those things enhance neuroplasticity. We've done our talk already on psychedelics, and psychedelics have been shown to enhance neuroplasticity via expression of that BDNF, that molecule, that hormone that enhances neuroplasticity. But now we know that there's another way, which is transcranial magnetic stimulation. Again, the application of very low dose electric stimulation to the brain that generates a magnetic field and forces the brain to form those connections. And to let you know, TMS as a methodology has been FDA approved since the 1980s. It's been FDA approved for many psychiatric conditions, including major depressive disorder, anxiety. It's been FDA approved for OCD, obsessive compulsive disorder. They've used it for smoking cessation. They've used it for insomnia. They've used it with a lot of success even for fibromyalgia and chronic pain because it's for the central pain sensitization. So there's many uses that it's FDA approved for. What I'm using it for, what BTL and me in my clinic, what I'm going to use it for, is what I call for the betterment of well people. You don't have to have a psychiatric diagnosis to use it. Everybody can use more nerve cells. Everybody can use more brain power in enhancing neuroplasticity with all the things that I said, plus TMS, is to increase cognitive function, executive function. The brain is the command center of the body, the executive boardroom of the body. This is what, especially in that area of the brain that we call the prefrontal cortex, which is on the left side of the brain in the anterior part. That's what differentiates us, the higher animals versus the lower vertebrate that don't have such a developed prefrontal cortex. So it's the executive center of the brain. When you stimulate that area and you form new connections, good things happen.
And when you say the TMS therapy, what what is actually happening in the brain during the session? What happens? Can you talk about that?
So I'm taking you back to physics that we've learned in high school and college. It's called Faraday's law. Faraday came up with that law in 1830 something. So it is when you generate current into an electric coil and you put it into a tissue that can conduct electricity, you can, it goes through it. So Faraday's law is, so the TMS, I want you to picture, it's two coils that you generate electricity to. It's actually a Tesla magnet. And that electricity, when it puts next to the skull, next to the brain, it doesn't even touch your skull. It's right by the skull on the left side, and that electricity generates a magnetic field that is passed on to the brain, and the brain is really generates electricity, and the neurons depolarize, and then they send an electric signal from the central nervous system down to what we call the nerve cell, the neurons, into the dendrites, which is the little root-like extension of the cells, all the way down to the muscle. So what's interesting when you do a TMS, I want you to picture it's like a little device that they put right next to the brain on the left side, and the machine goes. Uh, um, if you've ever done a MRI before, that's it. You hear some little clicking, and then that generates the electricity, and then it goes down. And the first time you do it, you look for somebody's what is called the minimum motor threshold. So to generate the electricity in that part of the brain, and you see the finger moves. It actually moves your muscle with just an electric stimulation outside of your brain. How fantastic is this? So the first time I did it, both me and the patient, we screamed. We're like, it's working. Imagine electric generated outside of your skull and your muscles actually move. So when you see that, you're like, oh my God, it's really acting on my nerve, on my central nervous system. And my central nervous system is passing that electric message to my muscle. Once you find that motor threshold, you don't go higher than this. So in here you stay and you stimulate the brain. So you entrain the brain. So it's almost like you make those nerve circuits. And they've done many different studies to show that as you do this, the little dendrites, which is the little root-like extension of the nerve cells, extend and they create new connections in the brain. So the treatment is very simple. The technician just comes in, places the machine in that specific area, and starts the treatment. It lasts about 20 to 30 minutes. And then, like, again, what ExoMind with BTL did, they have an AI calculation that gives you the exact stimulation, electric stimulation. It's very comfortable. You don't feel anything. The worst side effects that we have with our patients, it may be a mild scalp tenderness or mild headache, sensation of ear fullness, but most people actually fall asleep during this. Most people, when they get back up, they have a mild sense of euphoria that they're like, wow, something did happen to my brain because look, you stimulated my brain and my finger moved. Then we go lower than this. The key is while you're getting it, you don't see any peripheral nerve stimulation. With the threshold is low enough that it should not stimulate you. And again, like I said, TMS has been FDA approved now for 40 plus years. But in 2025, ExoMind, the new machine from BTL, came up and it streamlined, it improvised on the science. Now it's a very small device, it's sleek, it's painless, almost hands-free. Once you put it, you don't even touch it, and you let it go for 30 minutes. The old machines, some of them look like torture chambers. You see the patient muscles are twitching. You see the muscle face, eyes are twitching because there's a lot of wasted energy that go to the peripheral nerves. With the ExoMind, it is very simple. It stimulates your brain, and you should not see any outside twitching of your nerves. So very comfortable and pain-free to the patient.
And Dr. Rudy, I know that this is relatively new in this aspect of performance enhancement or brain wellness, but I've seen a lot of people who've gone through neurofeedback, right? And so I guess two parts question. One is how, I mean, there is obviously a big difference between neurofeedback and this, but can the same patient base or same people can go and get both things done, or are they
Definitely.
okay?
Yeah. So neurofeedback has that same base. It's you work with a technician with a who's trained in cognitive behavioral therapy and neurofeedback, and you do some EEG to try to see which area of the brain we're going to try to stimulate. So it is that same thing. The only thing the TMS um, leverages electricity. Nikolai Tesla said that in the late 1800s. If you want to understand the universe, you need to think in terms of energy. Our body communicates via energy. That's quantum mechanics. So you stimulate energy, and that energy turns into an electric signal, a magnetic field that depolarizes our nerve cells and then does muscle contraction, does new nerve connections. So it is the same principle as neurofeedback, somewhat different because there you use energy. But at the end of the day, what you're trying to do, it's neuroplasticity, new connections of the brain, having areas of the brain that did not connect before to connect, stimulating the prefrontal cortex. Specifically in TMS, we stimulate that specific area that's called the dorsolateral prefrontal cortex. Again, that's the executive room of the executive boardroom. This is the area that is specifically responsible for high order executive function, for emotional regulation, for cognitive power. So when you stimulate that and you make that area become more active, that's when you get more cognitive function out of it. Actually, they've done functional MRIs to see the blood flow after patients receive TMS treatment, and they see an increased blood flow in the area of the dorsolateral prefrontal cortex. So when it comes to brain performance, to increase performance, cognitive performance, that's the specific area that we go and that we stimulate. For example, they've stimulated other areas of the body to treat Parkinson's disease. They've stimulated other areas to treat PTSD. But that dorsolateral prefrontal cortex, the executive boardroom of the brain, specifically for cognitive and brain performance.
And so if somebody has had executive functioning loss, that would still be a good candidate to get the TMS treatment or therapy treatment for that matter.
Definitely. So whether you have a loss or you want to optimize, because the same thing, neutropenia, the loss of nerve cells happen to everybody. For some people faster than others. It's hard to quantify this, but everybody can use more brain power. Because when you have more brain power, good things happen. Sometimes after my patients do TMS, it's not even that they see an improvement in their cognitive function. Some patient told me that their creativity increases. Everybody will see different results. Some patients is their sleep that gets better. Some patients is their anxiety. Some patients is their brain fog that lifts, that gets better. So when you stimulate muscle cells, you get one response. You get hypertrophy of the muscle cells. They get bigger and they get more powerful. When you stimulate brain cells, so many things can happen. Cognitive function, creativity, so many things. Because the brain depends on where those functions happen. And what I do with my patients when they're doing a session of TMS, I have them do visualization, positive affirmation, box breathing, breath work, because that's also a form of neurofeedback. As you're doing the stimulation, you're kind of visualizing the things that you want to happen. And studies do show that cognitive behavioral therapy with TMS actually gives you even better results.
Very interesting. And you did mention that it was FDA approved for depression for very long, but obviously it is also used for other mental health enhancement and optimization, both, which is anxiety, OCD, PTSD, cognitive enhancement. So, specific to the mental health part of these things. Can you talk about if you had a patient who felt like, from their experience, what changed for them afterwards?
Yeah, so for major depressive disorder, it's FDA approved to use TMS, and they usually recommend 36 sessions of TMS. It's one a day, 5 days a week for 6 weeks, plus once a week for 6 more weeks. So you get 36 treatments. To be approved by the insurance, it has to be what is called treatment-resistant depression, meaning that you have to fail certain medical treatment, and that becomes a treatment after you fail some treatments. And same thing. So after you do those treatments, there's countless records of patients who've gotten off depression medication or could not get relief with the medication because the usual medication for depression, the SSRI, the selective serotonin reuptake inhibitors, there's almost 30 to 35% of patients who don't respond to it. And they come with a lot of side effects, including sexual side effects, including weight gain. So some patients either have bad side effects or don't respond to it. So what do you do with those patients? So that's when TMS becomes an option. Spravato, which is the FDA-approved intranasal ketamine, has the same indication, treatment-resistant depression. So for patients listening to this, if you're dealing with depression and you haven't gotten the proper response with antidepressant, you want to look at those FDA-approved treatments. TMS being one that it's no drug, no side effects, hands-free, and very comfortable for the patient. Ketamine, we've talked about this before, for the appropriate patient with treatment-resistant depression, that may be a very good option.
And obviously, we talked about psychedelics and also about GLP-1s helping also with the rewiring. Can you also touch upon how these three things are different or similar? Are they same impact on the brain rewiring, or are they different? Because you've done it all, so you are the best person to ask this question.
So I believe in stacking different modalities to get better results, right? So if you do one thing and it helps with anti-age management, it helps. But if you add many things, that's why for me, let me give you my stack, the best stack to help patients feel their best as they age. Keep your body fat low. Use GLP-1 as needed. And GLP-1 has been found to modulate those different brain centers and enhance neuroplasticity. Make sure you have good muscle mass. Increasing lean muscle mass is a really good recipe to increase BDNF. Make sure you eat a Mediterranean type diet with a lot of good omega-3 fats with good olive oil, been found to increase brain health. Make sure that you stimulate your brain with brain puzzle, learning to play an instrument, a new language, all of this. And then make sure you do either neurofeedback or TMS. And TMS now has become a tool in my practice to help my patients non-invasively, that you don't have to do a lot. Sometimes they say that TMS can replace talk therapy. I don't see it as a replacement. I see it as an addition. The more you stack all of those different modalities, the better results you will have. And at the end of the day, what do we want? We want more muscle cells, more brain cells, and fewer fat cells.
Got it. So Dr. Rudy's main, I would say, secret recipe here is the stacking. And by stacking this, you receive or you get the most optimal results that you're looking for.
Exactly. And that is true to everything you're doing, right? If you want to go to the gym and have a leaner physique, like increase your muscle mass, you stack creatine, amino acids, you do some cardio, you do a lot of weight training, you do flexibility, right? You do all of those things. You stack all of this. You do the same thing when it comes to functional medicine and age management medicine. But before, we never paid a lot of attention to brain fitness. Brain fitness needs to take a prominent part of the tools that an age management physician has. And my goal is to really bring that subject, because it's interesting. I've been doing functional medicine now for 15 years. It's only this past year that I started paying more attention to the brain, the command center of the body, the most important organ. This is where everything is controlled. Our hormone production, our cognitive function, our creativity, our mood, everything is controlled in the brain.
And as part of just Dr. Rudy, like, imagine if somebody's just coming for physicals to you, would you still recommend that as part of their routine or annuals, whatever that is, to have some sort of, I don't know, assessment for to see if they need TMS, or they should do some routine for the whatever is that stacked routine looks like? What do you recommend? What's the best practice? How should people go about it?
So that's a great question because we don't have, or I didn't know that we had an objective measure to monitor or to evaluate brain function. Unless you see patients, for example, I do a lot of geriatrics also. I'm the medical director of a nursing home. So when I see my patients who are older, you do what is called a mini mental status exam. So you ask certain questions, you have them recall, you have them do some addition, you have them draw a few things, and you get a score. And that score gives you an image, an idea of how well that patient is doing. But usually by the time a patient does bad on a mini mental status exam, they already have cognitive decline. What do we do to evaluate again a person that's doing well? Well, guess what? There is a technology available to evaluate that. It's called WAVI, W-A-V-I. It is an EEG, a portable EEG that you can do, and it monitors what it calls your P300 wave. I'm going to go a little technical here. So it is the P300 wave. It's when it gives you, it's a cool device that you put, it has a helmet that records an EEG, and it gives you a little sound, and it sees how quickly your brain responds to that sound. So it is an objective measure of brain response, of brain fitness. So I went and I spoke to the makers of that technology. So what I'm going to do in my practice, we haven't even started that yet. We're going to have, and the P300 wave and the WAVI device has been validated at multiple clinical scenarios, clinical studies. It is used in large centers as a brain function baseline. So it gives you a number, it gives you a really nice curve. And the goal is that whatever modality you're going to do, you can see an improvement of that P300 wave with the WAVI device. So what we're seeing is patients who do whatever kind of neuroplasticity enhancement, you see that there's an increase in that P30 wave. So I'm going to announce right now that I'm starting and me and my wife is going to lead that mostly. We're starting a new business called Brain Fitness Lab, where patients will come in to me exactly. This is not going to be your typical physical exam. We'll do a baseline brain function assessment with the WAVI and the P300 wave. Then we'll apply TMS, stack the right supplements, stack the right stimulus to really enhance neuroplasticity, and we'll do a follow-up. And the results that we're seeing already without the TMS are already good. Applying TMS is going to be a plus for brain fitness.
Just now, Dr. Rudy has announced that this is the practice where you can actually get your brain health measured to some extent, set the benchmarks, and then optimize from there. That's kind of how the approach you're taking.
Because if you don't check it, how do you know if it's getting better? The way we do it in clinical practice now, it's with validated questionnaires, especially when it comes to mood, depression, anxiety. So there's all those questionnaires that you do before and after. But those are very subjective. I use them, but they are very subjective. I always was looking for an objective measure of brain output. The WAVI and the P300 wave, validated by science, is what I'm adding. And then so exactly what you said, let's say my avatar, my typical patient that I'm going to go after, it's somebody maybe in the mid 30s, mid 40s and up that said, you know what? I care about my brain health. How do I measure where I am now? How can I improve it? And what can I do to improve it? And then we'll discuss, okay, what are the different stacking modalities that we're going to do, including nutrition, exercise, sleep, everything we've talked about, the pillars of health. But now we have a physical machine that can generate electricity and increase neuroplasticity, proven to really help improve the brain output, brain function. So again, look out for Brain Fitness Lab. We're going to start our first clinic in Miami, me and my wife. And our goal is to really expand this because I feel like the whole world needs this. I read a study recently that patients who've got COVID are showing a lot of cognitive dysfunction. mild cognitive dysfunction. Later on, they have brain fog. They can focus. They can concentrate. Patients who live in work in high stress jobs, they'll tell you that when you start getting into midlife, hormones start you getting hormone imbalance. Brain fog and decreased cognitive function is one of the most common complaints. What do we have for this? Stacking everything I've said before: losing weight, increasing your lean muscle mass, making sure you sleep well, making sure you eat well, making sure you increase your lean muscle mass. Now we have another thing: TMS.
Wow, this is really exciting. Dr. Rudy, is there something like this exists already at all? No,
So
or
right now there's a lot of tourism. For example, I went to Thailand last year. I went to a nice retreat where we did massages every day. We did fasting. We did yoga. We did breath work. Now they have a lot of um, um, retreats that are popping up with this for brain health. Red light, for example, red light photobiomodulation applied to the skull also has shown to increase brain function. So there are so many things now, but there are starting to be a lot more companies, a lot more retreats, a lot more wellness centers who are paying a lot more attention to the brain. So my intention, and it's already being done, is that we're going to take a proven methodology in TMS and apply it into the biohacking world, into the wellness world, and have an objective measure that you do before and after and really showing improvement on this. And again, it's not just one modality. You stack all of those modalities. Let's talk about supplements, for example. Supplements that help with brain function. Things like quercetin, resveratrol, NAC, glutathione, omega-3s, extra virgin olive oil with polyphenols. All of those things together improve brain function. So at our center, what we're going to do, we're going to stack all of those things. You're going to do a baseline assessment. You're going to do TMS. You're going to do some red light. You're going to take some supplements, and then we'll do a post-treatment evaluation. Right now, there are centers that are doing all this without a TMS, and they show significant improvement in the WAVI and the P300 wave. TMS is just going to be an added modality that has been proven, FDA approved for many different conditions that now we're applying for the biohacker for brain fitness.
wow, I feel like this is kind of like we haven't been able to benchmark or measure it. There have been different solutions to it, but you can't pinpoint to that, oh, that's where I made progress or that was the thing changed. Now what you are presenting is kind of like, let's just build this protocol sort of where we will start with measuring where you are and then help you optimize and over time show you how you're making the progress towards it, which is kind of mind blowing in a way.
Listen, I wish I could take credit for Wavi. I can't, and I'm going to give a big shout out to that company because I participated with a great one-on-one. I really went deep. I took a deep dive with some of the people using Wavi and some of the people who came up with this, and it's amazing. Ask me last year, did I know anything about brain fitness and neuroplasticity? I know very little, but it came specifically with body composition and hormone replacement. The last 4 to 6 months, I've done a deep dive and I realized brain health should be the optimum of the biohacker, the age management, the preventive physician. Because if we care about our health, we need to care about our brain health. And now we have an objective measure and we have stacking modalities that have been shown each by itself to increase brain fitness. When you combine all of them together, you get even better results. So
Fascinating.
mind blowing, man. This
Yeah.
is no pun intended, actually, pun intended, mind blown. This is going to be exciting. So we're entering an era of brain fitness. We're entering an era where we can actually not just leave it to mother nature, not leave it to father time to see our brain function decline. There's something we can do to positively influence that. And even more important, we have a ways that we can assess it and monitor and trend it. So anybody listening, go onto the WAVI website, WAVI, go and look at it. Look at the P300 wave, which is what they measure and how it's been clinically validated to be a good measure of brain output, brain fitness. and see if that's not something you'd be interested in. And then once you see that, you're like, oh my God, I should do that scan. I need to know where I am. I always say that change starts with knowing where you are, self-inquiry. And then once you do this, you're like, how can I improve that? And how you can improve that is everything that we said. And we should consider TMS as part of the stack for better brain fitness.
One thing that you pointed out that earlier too, that the focus on with the longevity focus, obviously when we are going to plan as a human being to live more, there has to be a clear focus on measuring brain health as well, because you can't this is not gonna happen in silo anyway, right? So this is I think this is where it's headed, and I'm glad that you're leading the charge as you do in many things. So this is always exciting. Wow, I'm blown away, but also excited at the same
I love that, Vivek. I always surprise you. I surprise myself because really, I never looked into it because the machines before for TMS were specifically to treat certain conditions, psychiatric conditions. I'm not a psychiatrist. I'm not a neurologist. So to me, I'm like, how do I influence brain health? Is by the things I do. Hormone replacement, body composition, nutrition, exercise, sleep, and mindset. Once I saw that this machine that BTL came up with, the ExoMind, that it is so easy, it's pain-free, it's easy to use. You don't need to use 36 sessions. So the studies are showing that you do one session a week for 6 weeks. And they've shown that it increased. They did a study on willpower, how it increases willpower. They've done a study on your resilience, how it does that. I'm actually involved in a study where we're going to study food cravings after using GLP-1, showing that like the hypothesis is GLP-1 help with food cravings because they modulate the area of the brain. And by stimulating the brain with TMS, that you can have sustained results on that weight loss and that control of your food. Preliminary results are already showing positive results on this. So it's exciting to know now that we can leverage electricity to hit biological function, brain function. This is We're living the Jetsons era right now. We're in the future.
yeah, crazy. So I mean, I'm sure in these last year or so, when you were exploring all this, you probably ran through multiple technologies, how this is done. Can you give us a little bit from your experience? Where do you see it's the tech heading in the future? Because some of the things that you might have seen is like coming in next few years. What is that? Anything that you saw that stuck with you? Like, oh, this is going to be even more, level up for the TMS therapies. Is there anything like that you saw?
To me, leveraging energy medicine is going to be the next big thing. So this is what they're doing already. They're leveraging electric current to to stimulate body functions, whether it's brain, whether it's muscle, whether it's the skin. So leveraging energy. And again, we're in the era of quantum era now. And what is quantum? It's energy. What did Nikola Tesla say? Think about energy and you'll understand the world. So I think the next big era of medicine, it's going to be leveraging energy, the magnetic fields to really affect different biological function. And TMS already is doing this. And I commend BTL. Again, I'm a speaker for BTL and I love what they're doing because they're able to really leverage energy into different parts of the body. Now they're leveraging to the brain. We've never been able to do that. Again, TMS has existed for 40 years, but for specific conditions. Now, the goal of BTL, my goal, is to leverage TMS for the betterment of well people, for the betterment of brain function. This is powerful.
Really powerful. Uh, this before we end today's conversation, Dr. Rudy, is it now time to update Dr. Rudy's best life code pyramid? And now, along with nutrition, hormone optimization, and psychedelics, is it time to add energy component to that? Tell me about that.
Completely. And we need to add neuroplasticity, making sure your brain remains active, is able to be molded into whatever's happening in your life to be able to meet the demands that are toxic, demanding, stressful world. brings. So yes, neuroplasticity, my war cry is say no to visceral adipose tissue, say no to fat, say yes to lean muscle mass, and say yes to neuroplasticity. And we
Fascinating.
can leverage energy to affect all of those different components.
Fascinating. I would have you to do the pyramid again so we can share it to the viewers with the new additions, updates to this, especially the brain health and how you want to name it, and
Definitely.
have it on the framework. That will be great to share with folks. And
And why I'm excited, why I love this type of medicine, functional medicine, optimization medicine, because things are rapidly evolving. And because of AI, because of the understanding of physiology, the understanding that electricity, energy can modulate biological function. You know, the Stoic philosophy said that thousands of years ago. Your thoughts make up your reality. If you think it, so you'll get it. So if you think a certain way, you can direct your brain into making it a reality. That's true, completely true. If you think about this, all the philosophers, all the books have always said that. Now you can leverage technology with electricity, magnetic field to be able to push that. So we're going to create superhumans as that goes further and further. And there, to me, yes, this is what biohacking is. You hack your biology to get better performance, for peak performance. Whether you hack your hormones, now your brain cells, you hack them to get better results.
fascinating. And I want to point out to our listeners too, uh, in this context, when we talked about in TMS therapy, those waves now passing through a certain area of brain, and earlier all these clunky big devices were there. This is actually happening because of AI. Because with AI, the tech is now able to very clearly define the exact target areas, to say so, put layman terms. And by doing so, these devices are getting super precise in their
Exactly.
operations. And that wasn't possible before AI. This is why AI is so transformational, especially in healthcare, medtech, whatever you want to
Yeah.
call it. And and this is just going to get better from here because that's
Yeah.
how we are progressing. That's why when everybody says like, well, this is the revolution, almost at the level of when we discovered electricity, AI in that way.
Yes. It
And
is 100%. And interestingly, I have to say that, of course, when you're going to go into a TMS, could be like, when can I do it? There are some contraindications. If you have an active seizure disorder, if you had a brain tumor, or if you have any metals in your head or in your neck, usually about 12 inches from where the therapy is going to be applied. So what we do at our clinic and what every TMS provider does before going into the treatment, you get a full physical, a full medical history to make sure that you don't have some of the contraindications. But the side effect profile is minimal, and it's used for so many conditions, psychiatric conditions already. We're going to use it. Again, I'm going to say it for the betterment of well people. We're going to use TMS for the betterment of brain function.
on that note, Dr. Rudy, if you haven't clearly laid out the plan when things are opening, but if people want to get to, is there a website or they can still contact you through here? Is there a website for the brain health clinic yet or your building?
So
What's
they can already go. It started. It's brainfitnesslab.com. It's going to be in construction, but we started doing the TMS treatment already. We have the new facility. We're getting the Wavi device. We're adding a lot of technology to it because we're going to make brain health a priority.
all right, folks. Get ready, especially folks in Miami. This is your chance to first get in the line to with Dr. Rudy and get there. And Dr. Rudy can't be excited. I think there's no better person to take this to the next level. And this is I like to say like not only you are optimizing health, you are optimizing your own stack to help people.
Yes,
Which is, which
yes.
which is what your innovation is, right? Like that's what you're bringing to the world and making it so useful to the people and get to their longevity goals and just overall fitness. So can't be
By the
more.
way, let me tell you my personal experience. I did my
Yeah.
6 sessions of TMS. First in it, I had no headache, no issues whatsoever. Very easy. And every time I finished it, I felt a sense of, man, that feels good. While I was doing it, I did my meditation. I did my visualization that my brain health center it's going to really take over the world. That, I remain this humble, dedicated, healer, that things are working out for me. And after the 6 sessions, one of my main issues is poor sleep. My insomnia has gotten better. My productivity has gotten better. My creativity. I think TMS is responsible for how much my brain, both me and my wife have done it. And we're both like, wow, we're like bursting with creativity. We feel like so motivated. How much does that play a role? I'm going to say it played a role. And I know for sure that my sleep has gotten better.
Wow, fantastic. I love this conversation, not just what you are doing, what you're saying. Today, you kind of walked us through how, as a physician, you came through this journey of how you made this decision that you will be building now this new practice, which I feel like I don't think you will ever hear things like this on any podcast. This is this is what I'm trying to tell everyone, that this is why this is so special. This is what makes it special, your journey and your experience, but also you are so transparent in sharing it. And again, Dr. Rudy, thanks very, very much. This was I got I got like a lot of things going on in my brain in what's going to come, but this is great. This is really great. Congratulations. Thank you for
Thank
sharing.
you. And we'll do a follow-up episode when I'm fully open, and we'll do a follow-up episode to go over everything. But for everybody listening, you need to care about your brain. You need to start thinking, what can I do to improve my brain fitness? One of the most important health questions we can have.
Yep. And on that note, we will say goodbye today, and we will share the link to the website too. It's still under construction, but we'll have the notes there so that you can reach out. But anyway, reach out to us from the show's website for now if you want to reach out to Dr. Rudy for anything related to brain health. Thank you, Dr. Rudy. Appreciate your time.
Thank you, Vivek.